thank you to our audience here today. We have over 300 people registered. And what this says to me is that this is a very important topic today. And so, as you heard just a moment ago, we welcome you to your best life. It's so important to pick up signs and to have the tools to do something about it and to find your joy. So, Dr. Frederick, tell us a little bit more about why this conversation about mental health is so very important to overall health for our members.
Thank you so much. And so glad to be here talking about mental health and your emotional wellness. The conversation is really important because of a couple of reasons. One, we want to reduce the stigma, the shame, the embarrassment associated with mental health symptoms, mental health diagnoses. And having the ability to talk about it is one way to reduce and eliminate that sense of stigma or shame and embarrassment. Talking about it also helps us get more comfortable. It'll allow you to talk to your caregivers, your primary care, your nurse practitioners, your family members about really important things that are happening in your life. And those are the symptoms associated with mental health. You should be able to speak comfortably, without shame, without guilt. This to us is no different than being diagnosed with diabetes, heart conditions, cancer. It's just a different illness that's treatable. In many cases, some are harder to treat, some are easier to treat. But if you don't speak up, you will suffer in silence, and there's no need for that to happen to anybody.
That's right. And I think about my perspective in the exam room with patients as a family doc. What I see repeatedly is just how important physical health is with mental health. And in fact, we know that chronic disease, as you mentioned, be it diabetes, heart failure, COPD, a number of reasons can contribute to the risk of, let's say, anxiety or depression or other reasons. Is this what you're seeing in the community?
It's a big component of what we see in practice. Roughly 40% of people that have chronic medical illnesses like heart disease, cancer, diabetes, also have co-occurring behavioral health conditions, primarily depression and secondarily anxiety. Those are the two biggest diagnostic categories that we see. There's many others that we do see, but depression and anxiety represent probably the top two. So there's a huge percentage of people that have chronic medical conditions that are also experiencing mental health problems. It's important to talk about that because those are treatable, just like your diabetes, heart conditions, cancer. Depression and anxiety is also treatable.
Exactly. And there's also a misconception that this is just an expected part of life. As we age, we lose our loved ones, or life cycle events happen and can be difficult to address and move forward. But there's so much that we can do. Can you share a little bit about what you hear and how that particular misconception can prevent people from actually speaking up with their PCP or a mental health expert?
Yes, that's a great point. Depression is not a normal part of aging. There are risk factors, though, associated with this population and having a higher prevalence of certain types of mental health problems. So depression affects an unbelievable 60 million plus people, just adults in this country. Anxiety disorders are very high as well. There's probably around 40 million in this country being diagnosed with anxiety type disorders. But it's very important to note that physical health conditions can lead to behavioral health problems, and vice versa. Behavioral health conditions like depression and anxiety, especially if they're moderately impacting your level of functioning on a daily basis, can have a direct impact on physical health outcomes. And so if you're depressed and you can't get out of bed and you have no energy, you're losing your appetite, maybe you've lost weight, maybe you've gained weight, maybe you're feeling so anxious and confused and forgetful, and those kinds of symptoms are happening to you, you're less likely to comply or adhere to your medication regimen, your exercise routines, your diet, and things really can be impacted overall, not just your mental health, but your physical health as well.
Well, and you said it. It is not a normal part of aging
It is not.
to feel depressed, to to have anxiety that affects you in your daily life. It can be very challenging to know what is the difference. What's the difference between grief, because that's so real in our world, and other situations that can cause anxiousness or anxiety.
Yeah.
And so this is why we need help, yes?
Yes.
In partnering to figure out, when do we know it's time to speak up? What are those strange signs that it's something that we do need to talk about?
Right. So there are some, indicators based on how you're feeling. But I would say in general, if you feel like something's not right with your emotional wellness, um, it's time to get help. It's time to ask somebody for some assistance, for their feedback, for objective kinds of sounding board information. Am I okay? And I think that one of the things that keep us from doing that is a fear, right? That I'm going to get diagnosed with something,
Mhm.
and a fear of treatment as well, because there is a commitment to
Mhm.
seeking care. But I would say that if you have feelings that something's not right, that you should be feeling better by now, especially related to grief. And
Mhm.
there's no normal timeline for a grief response, right? There are certain stages that people go through,
Mhm.
but there's not a timeline. Everybody's different.
Mhm.
So if you feel like I should be over this, I shouldn't be crying every day. Um, my appetite shouldn't be impacted. Um, then I think your feelings are probably right. It's probably
Mhm.
time to talk to somebody. Don't be afraid to do that.
Yeah. And I will say it's not like blood pressure in the sense of, if I have hypertension, my blood pressure reading might be up. If I have diabetes,
Mhm.
my lab values or my A1C may be up. So it can be difficult for the individual themselves to pick up when it's time.
Yes.
And so often we do have loved ones, be it family or friends, who may notice a difference. What can we share with, for example, caregivers
Yes.
or our loved ones, to know when is it time to perhaps approach that individual, what you're recognizing, what does it look like from the outside? Because we also talk about sometimes it shows up physically, or it might look different
Right.
for someone over the age of 65. Or
Yeah.
I think about my mother, she's 74.
Right.
I want to be tuned into what can I look for her
Yeah.
if we start to experience some of these symptoms, because they could be new, right? It could be the first time
That's
they
right.
experience this.
That's exactly right. And hopefully your mother will feel comfortable enough talking to you about changes that she's experiencing or worries that she has about her health, right? And
Mm-hmm.
same goes for you all. If you have close family members that you communicate with on a regular basis, I would tell them what changes you're experiencing. Ask them to go to your next doctor appointment with you, and so that you can share the information that you have about whatever concerns there are. Talk to the
Mm-hmm.
PCP, to the nurse practitioner, tell them what changes are happening, and we're going to pop up a phone number to the Behavioral Health Services for Essence members. You can call us 24/7, and we can walk through some of the screening questions that exist. And we don't have blood tests, right?
Mm-hmm.
We don't have those kinds of objective lab results that you can get with diabetes or cancer, or we don't have scans, but there are screening tools for depression, for anxiety, for substance use, for suicide ideation, and risk factors. So we can help with those kinds of objective tools to help you get a better picture of what you're dealing with. Is there a diagnosis? Is this something that you can get help with psychotherapy? Is a psychiatrist needed for medication management? Things like that.
Hmm. And these are important questions that we're also asking in the doctor's office. So I encourage you to have your annual wellness visit. There's a number of reasons why annual wellness visits are so very important. It's about screening, it's about your function and assessing. As the physician in the room, we're asking, what are your risks? And a risk for anxiety and depression can also contribute to your other physical risks, be
Right.
it fall risk, or sometimes we see urinary incontinence, physical health, mental health, all of these tied together are things that we want to know about in a doctor's office. So I think that's important. Something else I want to say about that is what may appear to some as dementia or worry about their memory.
Mhm.
Can we see that with anxiety, depression? I know I've
We
seen it
do.
in the exam room, and people may be afraid, oh my goodness, I didn't want to say anything because I thought it was dementia and it scared me.
Yeah.
When all along, what we thought about was, well, I lost my spouse, my
Yes.
partner a few months ago, or I lost my dog
Right.
recently. That can
Absolutely.
trigger some of these symptoms too, yes?
Yeah, absolutely. I mean, even I'm no longer physically able to go play my bingo or my card game, my
Mm,
poker buddies, I can't do that anymore. And so many symptoms mimic uh, physical health problems. And we had talked briefly about anxiety and depression,
mhm,
but if you're suffering from those kinds of symptoms, it can include things like forgetfulness, confusion, um, even things that you normally take advantage. Can't remember my address. I've lost my phone number in my head. I can't, it just
mhm,
doesn't, it's not there anymore. But certainly longer term, symptoms of depression and certainly anxiety, panic type symptoms can impact your overall health.
mhm,
So it's not just you can't separate out physical health from mental health. There's a very strong component interaction to both, and a lot of people suffer from both. Not only having depression and or anxiety or both, but blood pressure problems, diabetes, cancer diagnosis, which really ramps up your anxiety.
mhm,
And so there's a very strong interaction between the behavioral health and physical health problems that should be addressed overall. So make sure your PCP, your nurse practitioners know what kind of behavioral health concerns you have, whether it's a vague symptom of forgetfulness or confusion, not being able to sleep,
mhm.
eating disruption, things like that can really get fine-tuned in terms of your treatment plan. Not only do you need a better A1C outcome, but you also have to have a lower depression screening score as that gets screened on a quarterly or more often basis.
Well, you've done a great job, Dr. Frederick, summarizing all the different symptoms, and it is quite a spectrum. They
It
can
is.
be simple, non-worrisome, some warning signs I know we pay attention to. And so my hope is that today you all in our audience can recognize this in perhaps yourselves or your loved ones and feel comfortable speaking up. And then now let's talk about what we can do to protect ourselves from when we're feeling strain, when maybe we're feeling sad, or
Mhm.
what can we do, whether we're officially diagnosed with depression or anxiety, another condition, or if it's just because we want to stay mentally healthy.
Yes.
What are some things that we can do?
Yes. And I hope you don't mind. Before I go there, I want to talk a little bit about um, suicide.
Mm,
It's another area that we don't like to talk about. We're ashamed to talk about it. But just briefly, um, the the biggest age category for highest risk suicide is males above the age of 85, which is a really sad comment. But in males, the suicide rate increases as we age. For women, the suicide rate increases up to about middle age, and then it drops off. So males are about 4 times more likely to die by suicide than females. And I just want to throw that out there because a lot of people who suicide have depressive disorders, anxiety disorders, psychotic disorders. And that's something else that we need to be open about when we're talking
Mhm.
about our mental health. If you're having suicidal thoughts, and there's a range of seriousness or intensity or risk,
Mhm.
let's get it out there. Let's talk about it. It's treatable.
And you said it. Let's talk about it. We care about you at Essence. We know your physicians do, your care teams, and especially your loved ones, caregivers.
Absolutely.
I think that's really important. So, that being said,
Okay.
we make it to our annual wellness visit or we follow up with our primary care because we want to know more. What can we expect to happen next?
All right. So there's things that you can do to ensure your emotional well-being as much as your physical well-being, right? And you probably heard this from your doctors. Move around, get some
Mhm.
movement going. It doesn't matter what kind it is. Check with your doctor before you start an exercise program to make sure it's safe for you. But even if you're walking a lap around your house, and then after 6 weeks you're walking 5 laps around your house, that's great, right?
Mhm.
Increased physical movement gets the blood pumping, the oxygen going. So physical health improves, mental health improves. Make sure you're maintaining a diet. I cheat all the time. I
Me
do.
too. I
Okay,
do.
we all cheat, uh, but eat healthy as much as you can. Um, and then for sure, if you're feeling like something's not right emotionally with you, whether it's loss of a loved one, you're grieving, the loss of a family member or a friend, or you're feeling down, you've got the
Mhm.
blues, you're feeling down almost every day for at least 2 weeks. That's a sign of having a depressive disorder. So it's important that if you're having symptoms, like we talked about, that you get it screened. Go to your doctor, call us. We're going to flash that number up, but give us a call. It's completely confidential. We can get you connected to behavioral health services that'll help get you screened and develop a treatment plan that fits you the best.
Well, and we hope that you're hearing the repetition in what we say and why it's so important. This topic is not discussed enough. I'm so glad we're here today to do this work. I think it makes a difference. And I really appreciate that you talked about that overlap between physical health habits, mental health habits, eating right, sleeping, exercising. We know there are studies that show that exercise can work as well as some medicines.
Right.
Now
To affect your mood.
yes, you want to talk to your PCP about that. We know the same with sleep. So very important. And as we age, we also recognize it can be more challenging to get a good night's sleep. So all of those reasons are things and ways that we can protect ourselves, that we can also improve perhaps the symptoms that we're having.
Absolutely.
So that being said, there are a lot of resources and ways to connect, be it through your PCP or other services through behavioral health. Can you talk a little bit about those other channels? Do you have to go in person? Because that may be intimidating.
Yeah.
Are there
Could be a
virtual
barrier,
options?
too.
Yes,
Yeah.
a barrier to care. So what can our members do?
We do. So Essence Behavioral Health has a large network of licensed providers, behavioral health specialists. So those include counselors, social workers, psychologists, nurse practitioners, psychiatrists, and facility-based services and clinic-based services available for a wide range of mental health problems, not just depression or anxiety or psychotic disorders, the full range of services. Um, Make a call to our toll-free number. We will do a brief screening by phone. It'll take a minute to get the information that we need. Identify what you're looking for. If you know a therapist that you want to see and you just want to make sure they're in network, we can help you with that. If you want recommendations about what kind of therapist or what kind of practitioner to see based on your symptoms, we will help with that. We'll get you connected. And if you're in more of an urgent situation, that you know you've got an alcohol problem and you're going to need medical detox, we will get you connected with those services as well. If you're feeling like you're wanting to hurt yourself or wanting to hurt someone else, you've had suicidal thoughts for maybe a few days, it's scary, you want to talk to somebody, we are available 24/7 to talk to. And if needed, we will help you get connected to a hospital that's close to you to get the kind of help that you need and to keep you safe.
And we are here for you, to our audience. This is how we Medicare together at Essence Healthcare. And thank you, Dr. Frederick, for all of your ideas, your thoughts, and be it a conversation you have with your PCP,
Yes.
or contacting our mental health services that are available 24/7. There's so many opportunities from in the office and outpatient as well as inpatient. Whatever is needed, we want to meet you where you are in the
Absolutely.
conversation. So that being said, I'm thankful for our audience today joining us. And I would just ask you to wrap us up. What is the one takeaway that we want our Essence members to remember, and how can we empower them to live their best lives?
Yeah, two things. One is I wanted to go back to something that you mentioned. Our services, the behavioral health services, are available in person or virtually. You can stay at home, in the comfort of your house and receive therapy services. So just keep that in mind. The other most important thing is let's talk about it. That's the key message that we want to share with you today. Please talk about your emotional well-being, your physical health, the symptoms that you're experiencing. And if you feel like you're not getting the answers that you need, call the Essence Behavioral Health line. We will talk to you. We will get you connected to services. And we also have case management, just like on the medical side. We will stay connected with you until you're in a treatment plan that's working for you. But the most important thing is talk about it.
Well said. Let's talk about it. Know your health and speak up, speak your mind, and caregivers, family, friends, speak up on behalf to support. Because at the end of the day, it's about finding your joy, living your best life. And so as we wrap up, we want to hear from you. What questions might you have for Dr. Frederick today?
Hopefully they're easy.
Well, we've given them all the answers,
Right.
haven't we?
Thank you, Dr. Saria and Dr. Frederick. One question we got, my wife passed away 6 months ago, and to be honest, I'm just not enjoying life anymore. Feels like a constant struggle. Lately, I've had thoughts of just taking pills so I can go to sleep and never wake up. It's hard to talk about this as a man, but who can I actually reach out to? It's a hard one.
And I'm so sorry to hear that, but thanks for asking the question and allowing us to talk about the answer. So grief is very hard. And I think I mentioned before, there's no timeline on when you're going to feel better. You will at some point. But in the meantime, you're having, or it sounds like you're having some passive suicidal thoughts, right? You're not actively looking for ways to hurt yourself. Maybe you don't have a plan to do this tonight or tomorrow morning, but you do need some help because you are having some thoughts of dying and not waking up. Those are serious thoughts, and we want to make sure that you return to a place where you're feeling better about the loss that you suffered. I would highly recommend and encourage you to contact us, talk to one of our clinicians by phone, and let us help you get set up with a grief counselor that can help you maybe move faster through the stages of grief that basically everybody needs to pass through after losing a loved one. So please give us a call. We'll help you get connected to a grief therapist that can work with you on a regular basis.
Yeah,
Any
thank
thoughts?
you.
Okay.
That is all the right information. Reach out. As you said, reach out, speak up.
It's the hardest first step.
Yeah.
And you were right,
Yeah.
especially for men. It's hard for men to ask for help.
Mhm.
Thank you for that. Uh, that was definitely a hard situation. Another question that we got, I lost my sister last year and I still cry most days. How do I know if it's normal grief or if I actually need professional help?
Mhm.
That's a great question, and I'm sorry for your loss as well. As I mentioned, grief is really, really difficult. Um, you know, I think if you're worried about whether or not this is normal, then it's time to get some objective feedback. If you're crying every day, and it's impacting your day-to-day functioning, whether it's work, taking care of the house, taking care of the kids, school starting right now, and maybe that's going to just pile on to the stress that you already feel. I would say reach out, call us. We have grief counselors in the network available, and they will be able to help you identify whether what you're feeling is average, normal, or if it's something, maybe a little bit more. Maybe it's moved from grief feelings to depression, but they can screen and identify whether there's something else happening. But call us.
Yeah, I want to repeat back what you said just a moment ago because it struck me. Oftentimes we forget this piece is we can be experiencing our own grief. And I say experiencing our own grief because every one of us experiences it differently.
Yes.
But what you said about getting an objective observation, I
Yeah.
think is really important here because your family members could be struggling with the same.
That's
And
right.
you may wonder, well, they seem to be just fine. Why am I struggling so much? It's okay to be different and it's okay to miss and have a little heartbreak, but you called it out there as that difference
Yeah.
that you feel and you may not be able to tell that and the people around you may not be able to recognize that because of their own feelings.
Yeah, totally agree. And I think if you yourself are asking, is this normal? You must be feeling like there's something different, right? This may not be average for me. Or why can't I get better? Why can't I get over this faster? And so having that objective person that has some expertise with grief and grief counseling will be able to help.
Thank you. We got another question. How important is the presence of a pet in the household for one's mental health?
Oh, I love
That's a
this
great question.
You
Yeah.
see our smiles. I'm thinking about my own pets in my home,
Yeah,
my pup and my kittens.
right.
What do you think about that? I think you probably know where the answer is going. There's some evidence there.
Yeah, absolutely. I think it's awesome. There is some evidence that pets, like dogs, cats, even goldfish,
Hmm.
can have an impact on your emotional well-being. It could reduce your stress levels, increase calm into your life. Um, and there's an old saying that somebody that's for someone who's sad, right? Most of the day, somebody would say, "Oh, go buy a puppy, for God's sakes. Go get a goldfish. Hug your pillow." That's not a good one, but I think pets do have a somewhat of a scientific validity in terms of helping to reduce the stress that could lead to anxiety and depression in your life. So I'm all for it. Do you have a dog or
I
a pet?
do.
You
I
do,
have
yeah.
a dog and two cats,
Okay.
and I always know when it's morning time. Now,
Yeah.
perhaps George, that's the name of my cat, will remind me it's breakfast time.
Right.
But I take that moment to remind myself of how special all of those relationships are. And there's
Yeah.
nothing like, petting your cat or your dog or talking to your goldfish.
Absolutely.
Sometimes that's preferable.
Yeah.
They don't bark. There's not much cleanup there.
Yeah. And it helps to stabilize your routine throughout the
Yeah.
day, right? When
True.
you get home, this is what you do with your animals.
That's
Before
great.
bed, you do certain things.
Yeah.
At dinner time, you do certain things.
It can also help prevent social isolation, which we know
Does.
that loneliness can be created, and our pets can fill that void sometimes.
That's a great point. Buy a pet, everybody.
Everybody go to the Humane Society.
Um, this is kind of a comment, but I think it's something good to address. 14 years ago, I lost my job, went through a divorce, and dealt with cancer all within a matter of months. I still have days on end where I just want to nap all day and I lose motivation. I'm now 75.
Mm, mhm.
And I'm so sorry to hear that. That is a lot of loss and grief to deal with. Thanks for bringing that up. Appreciate your question. There are certain things that we can help with. One, if you haven't seen a grief counselor, um, we can help you get connected with one. It's not too late, right? Grief can last a very long time, but you should be able to talk about that, your feelings about it, what you're missing, how it is for you. And just because you've maybe been treated and even cured for cancer, there's still emotional impact there that you can deal with. And so I would highly encourage you to call us, get connected to a counselor to talk to. Um, and I hope that you're not feeling like this can't be better, or if you're having suicidal thoughts or feeling like you just don't want to wake up anymore, please reach out. You can call 988. That's the National Suicide Lifeline. They're 24/7 as well. You can call us 24/7 for help. But please reach out. And I think primarily the main focus, the main point that we're trying to express today is share it, talk about it, get it out in the open. And so hopefully you'll consider calling us.
Mhm, mhm. I so appreciate the audience today and sharing their personal stories because these are common. This is what we hear often.
Yeah.
In fact, this is a typical presentation of a patient.
Yeah. You know, the interesting thing is that these statistics that we talk about, right? The 40%, the 60 million, these are real people with real feelings, real families, real friends, real dreams. And so that's what we're passionate about, is the people behind the numbers. Call in. We want to help you. That's what we do for a living. We want to help, but you have to make that first step possible. You have to call.
That's right. Let's Medicare together.
Yes.